And welcome back to Idaho Today. Diabetes, it's one of the most common diseases worldwide. According to the World Health Organization, more than 422 million people suffer from some form of diabetes. Diabetic polyneuropathy is a progressive form of diabetes that kills nerve fibers, leading to the loss of nerves, increased sensitivity, and the development of foot ulcers. So we spoke with anesthesia specialist Dr. J.D. Williams from St. Alphonsus to learn about a spinal cord stimulation treatment that St. Alphonsus offers to help their patients. Dr. Williams, help me understand, what is diabetic polyneuropathy?
Yeah, so diabetic neuropathy is the most common form of peripheral neuropathies. There's many etiologies of it, you could say, but about 60% of all cases are from diabetes. Essentially what happens is a patient has high blood sugars from their diabetes, they can have poor blood flow, and even metabolic derangements, things like high cholesterol. They all summate and they essentially cause damage to the small nerve fibers in usually in your lower extremities, and your feet is where it tends to start. Common presenting symptoms can be just numbness, tingling, a little bit of abnormal sensation, so altered sensation to touch or temperature. Sometimes people endorse a sense of imbalance even, so it can even lead to increased falls. Unfortunately, most people, again, the longer you've had diabetes, increases the chance that that will progress to frank pain. That kind of burning, really difficult to solve kind of pain is usually what the classic diabetic peripheral neuropathy entails.
Okay, all right. And then tell me, what is spinal cord stimulation and what does it have to do with neuropathy?
Yeah, great question. So the origins of spinal cord stimulation actually go back to the ancient Romans. So
really?
They would use, they used torpedo fish, and they would submerge a patient's foot in it, and they would discharge electrical currents, and that's how they would treat pain. So we're a little bit more advanced to that now, but the whole idea the whole idea being, we can implant or put in some tiny electrodes into the spine essentially, and through very low dose electricity, using very specialized waveforms, we can essentially increase the number of signals that sort of calm down or decrease those pain signals, and decrease the number of signals that increase pain. So leading to better pain control, better function of life, better quality of life overall.
Okay, so the electrical pulses, if you will, then kind of help treat that neuropathy?
Exactly, yeah. So we think even though the damage is in the peripheral nervous system, or say in your feet, we know that there's that central part, the spinal cord, that plays a very large role in pain transmission. So that's kind of where we target it with our therapy.
Okay, and then so this is obviously a pretty important treatment then for those who suffer from diabetic neuropathy, because it might result in some relief, right?
Absolutely, yeah. So a lot of people, the current treatment algorithm, if you will, right, usually start with nerve-type pain medications. Unfortunately, a lot of people don't achieve meaningful pain relief with medications, or they have intolerable side effects, so they just can't tolerate those medications. Beyond medications, there's not a lot, or historically has not been a lot of great options for these patients. So again, spinal cord stimulation can be a really crucial therapy, again, decreasing overall pain, but also improving function of life, mood, sleep, all those other indicators of quality of life as well.
So how does one find out if they are a good candidate for treatment like this, the spinal cord stimulation?
Absolutely, yeah. So usually your primary care doctor knows that you have this, but it would start with a referral to someone like myself. We'll evaluate all your records, we'll look at sort of previous treatments you've tried, kind of confirm the diagnosis, just making sure that we're going down the right correct path, and knowing that this is truly diabetic neuropathy. After that, if we kind of collectively decide that you're a good candidate for it, there's a couple more steps involved. So usually some advanced imaging, just to make sure your anatomy is amenable to the procedure, and some additional evaluation by some of my other colleagues, just to make sure you're an ideal fit for it.
Okay, and then if someone does go through this process, what type of outcomes can they expect?
Yeah, absolutely. So we do it on a trial basis, which is nice. So you get a try before you buy, like I say. So you put temporary leads in, you go home for a week, and just make sure that this therapy helps you. If that helps, then we can do more of a permanent implant in the operating room. Everything's done on an outpatient basis. But as far as outcomes, what we look at is 50% improvement overall. That's for sort of a general metric, if you will, in the pain world. Going back to the data, so I always like to cite studies, about 7 in 10 people will meet that 50% threshold of improved pain. But sort of like I alluded to as well, we also like to see improved mood, improved sleep, improved function, which again are all almost as important as the pain score itself, right?
Yes.
And those studies go out to 5 years. So again, we expect fairly durable pain relief for at least 5 years based on the data that we have.
I can just imagine the quality of life improvement, right? Almost like you get part of your life back.
Absolutely, and that's the goal. It's, you know, we care. I always tell patients we care about your pain scores, but I care more about your function of life.
Yes.
You know, hanging out with your family and doing the things that
Yes.
you need to be doing. So.
Yeah, because we know all the things that, you know, constant pain can impact, like you mentioned, the sleep, which then impacts your mood, which then impacts everything else that you want to do. So wow, fantastic to hear of this potential solution for some of those sufferers. So if someone is interested, where do they go to learn more?
Yeah, so you can, you know, referral to St. Alphonsus, Dr. Williams. We'd be happy to take care of you. We're also, you know, rolling out some other initiatives, some screening tools, things like that, and also just talk to your primary care physician and just, you know, say you heard about this therapy, and that's a good starting place as well.
Wonderful. Thank you so much for the good news today.
Yeah, thank you.